Prostatitis. What is the cause of venous stasis ulcers? Chronic venous insufficiency. What is Pancoast syndrome? Superior vena cava syndrome secondary to a tumor/metastasis in the apex of the lungs? What is bronchiectasis? Permanent dilation of bronchioles. What is the name of an abnormal dilation of the terminal throat of the esophagus? Achalasia. What is the name of the knot that happens in the small intestine? Volvulus. What is the name of a self-swallowing intestine? Intussusception. What is the syndrome resulting from a hyperproducting tumor of the adrenal cortex? Cushing's. It presents with hypertension. What is Addison's disease? It is a lack of cortisol production. It presents with hypotension. What is myxedema? It is non-pitting edema of the tibial region in Graves' disease due to excessive fibrous tissue in that region. What is myxedema coma? Is a severe hypothyroidism leading to loss of consciousness. What are the visible expression of hyperthyroidism? Sweaty, skinny, exothalamus, hyperthermia, tachycardia, hypermetabolism, weight loss. What is the name of the resulting syndrome after infarction of the pituitary from blood loss during delivery? Sheehan syndrome. What happens if someone suffers an infarction of the thymus? Loss of maturation of T lymphocytes. How do you classify hypertension? Primary and secondary. What is alveolar dilate and atelectasis? They do not, they collapse. What is an open pneumothorax? When the hole is such that there is no accumulation of pressure in the pleural space. What is the name of the bleeding pneumothorax? Hemopneumothorax. When do you get orthostatic normotension? You always get that when you stand up. Arteriosclerosis involves the presence of plaques? False, it is hardening of arteries. What is the proper name of a cardiac sacculation? Cardiac aneurysm. What is the bottom line damage in diabetes mellitus? Diabetic microvasculopathy. What is the most frequent cause of vasculitis? Autoimmune attack of the basement membrane. What is the main characteristics of Prinzmetal angina? unstable, unpredictable occurrence. Can spontaneous pneumothorax become tension pneumothorax? Yes. What is the name of collection of fluid between pleura? Pleural effusion. What is the name of collection of pus between pleura? Empyema or pyothorax. What is the name of collection of lymphatic liquid between pleura? Chylothorax. What is the difference, and why in subendocardial versus transmural infarctions? It depends on the location of the embolus. If it is a smaller branch, it will be subendocardial. What is the most common trigger of lung abscesses? Pneumonia. The opening of a lung abscess into a bronchi is called vomica. Fibrosis of the alveolar capillary membrane is called what? Pulmonary fibrosis. Pulmonary fibrosis is common in what conditions? Pneumoconiosis with chronic nanoparticle inhalation. What are the most frequently affected coronaries when you get valvular infarctions? You cannot get valvular infarctions because they are not supplied with blood. Increased chronic pulmonary resistance with right ventricle strain and failure will lead to what? Cor pulmonale. What is the name of a break in the protective mucosal lining of the stomach? Peptic ulcer. Hepatitis D may be transmitted by sexual contact? True. What is the name of the chronic hepatic tissue damage with nodular and fibrotic results? Cirrhosis. Give an example of left to right shunt. Ventricle septal defect and atrial septal defect. What is the difference between aortic coarctation and aortic stenosis? Coarctation is narrowing of the aorta located mostly juxtaductally, while aortic stenosis is narrowing of the aortic orifice. Coarctation of the aorta is usually juxtaductal but may be abdominal? True. Where is the ductus arteriosus? Located between the pulmonary artery and the aortic arch. A patent ductus arteriosus will produce a left to right shunt? True. An atrial septal defect will produce what kind of shunt? Left to right shunt. What could be the reasons for poor hormonal expression? Problem with the receptors either due to insensitivity or reduced amount of receptor. From the renal point of view, what is the result of deficiency of antidiuretic hormone? Polyuria. What are the different kinds of anemia? aplastic, iron deficiency, megaloblastic, hemolytic. Which of the following correspond to isovolumetric ventricular systole? Ventricles receive blood from atria. False. Which of the following correspond to isovolumetric ventricular systole? Residual volume remains in ventricle. True. Which of the following correspond to isovolumetric ventricular systole? Blood rushes out through the aorta. False. Which of the following correspond to isovolumetric ventricular systole? Ventricle empties into aorta and pulmonary artery. False. The QRS complex represents ventricular repolarization and atrial depolarization. False. Ventricular depolarization and atrial repolarization. The T wave represents ventricular polarization. True, in between repolarization and depolarization. What is the name of the wave representing atrial repolarization? It has no name. The positive and negative electrode in an electrocardiographic machine are designed to record the movement amplitude of heart muscles. False. The positive and negative electrode in an electrocardiographic machine are designed to record the electrical voltage in heart chambers. False. The positive and negative electrode in an electrocardiographic machine are designed to record the electrical voltage on the myocardiocite sarcolemma. True. What is the name of an area of the heart that starts controlling impulses on its own? Ectopic site. What is the most frequent cause of ectopic pacemakers? Ischemic spots on the myocardium. What is the name of the right and left intraseptal bundles? Right and left bundle branches. What is the interatrial equivalent of the Purkinje fibers? Branches of interatrial bundle. Regarding the heart, at what level is the biochemical and metabolic exchange done? Capillary level of the coronary arteries. The arterial circulatory system of the GI tract is called portal system. False. It is the splanchnic circulation. What area is drained by the popliteal vein? The sole area. Regarding the hand, and using directional terms, what is the location of the digital arteries? Lateral to the fingers. What is the generic name of the key circulation? Splanchnic circulation. The name of the major structure of brain circulation is the carotid sinus. False. It is the circle/polygon of Willis. What are the two most important veins draining the lower limb? femoral vein and saphenous vein. What are the two most important nerves innervating the lower limb? Femoral and sciatic nerves. What is the biggest venous draining of the brain? Superior sagittal sinus. What is the most important venous sinus from the infectious POV? Cavernous sinus, located posterior to the nose intracranially. Where does the internodal bundle exist? Between the SA and AV node. The aorta and its major arteries are elastic arteries, propelling arteries are muscular and capillaries are followed by sphincters. False. There are no propelling arteries and capillaries are preceded by sphincters. What is the real heart pacemaker? Sinoatrial node. What is the name of the venous draining of the heart muscle? Coronary sinus. The phrenic cranial pair that innervate the heart has sympathetic and parasympathetic fibers. False. It is the vagus nerve. The vagus nerve only has parasympathetic fibers. The right coronary artery divides into posterior interventricular and marginal arteries. True. The left coronary artery divides into the anterior interventricular and circumflex arteries. True. What is the circulation of the septum? The anterior and posterior interventricular arteries. How many coronary arteries do we have? Left and right. What is the electrical expression of the papillary muscle? U-wave. What is the name of the distal connection of papillary muscles? Chordae tendineae. What is the name of the papillary muscle for the aortic and pulmonary valves? They don't have papillary muscles. What kind of valves are the valves inside the aorta and pulmonary trunks? Semilunar valves, also known as Swift-Nest valves, aortic and pulmonic valves. Is the skeleton of the heart an electrical conductor? False. It is an electrical isolator. What is the relationship between the intercostal arteries and the heart? There is no relationship. The anterior and posterior coronary arteries are branches of what? There are no anterior and posterior coronary arteries. All valves of the heart are unidirectional? True. The semilunar valves of the heart are atrioventricular? False. Aortic and pulmonic. Why is the blood pressure in the lungs different from the blood pressure inside the legs? It requires less force to pump blood through the lungs because the pressure in the lungs is less than in the body. In general terms, what is the origin of the systolic murmur in aortic focus? Aortic valve stenosis. What is the origin of a diastolic mitral murmur? Mitral stenosis. The papillary muscle is maintaining the proper tension of aortic and pulmonary valve? False. It is mitral and tricuspid. What is the result of papillary muscle infarction? Loose chordae tendineae and valvular insufficiency. The sum of all activity of papillary muscle add to the overall strength of the ventricle? No, it does not. Portal hypertension leads to pulmonary hypertension? No, it doesn't. What are the layers of the epicardium? There are no layers. The heart is the biggest structure in the mesenterium? False. It is not located in the mesenterium but in the mediastinum. Physiological buffers act to balance ionic acids and electrolytic bases? False. There are no ionic acids or electrolytic bases. The physiologic exit of carbon dioxide through the lungs reduces the bicarbonate in blood? False. It reduces the hydrogen ions in blood. pH is the positive logarithm of hydrogen ion concentration in 1 liter of solution? False. pH is the negative logarithm of hydrogen ion concentration in 1 liter of solution. When does the rate and depth of breath rises? In acidosis. One example of metabolic acidosis is what? Ketoacidosis. Pancreatitis produces metabolic acidosis? True. Prolonged hypoventilation produces metabolic acidosis? False. It is respiratory. Starvation produces respiratory acidosis? False. It produces metabolic acidosis. During acidosis, the kidney excretes what? Hydrogen ions and gains bicarbonate ions. If increased hydrogen ion excretion by the kidneys during metabolic acidosis in exchange for calcium leads to hyperkalemia? False. Calcium is not exchanged during acidosis, but sodium. If increased hydrogen ion excretion by the kidneys during metabolic acidosis in exchange for calcium leads to hypokalemia? False. Calcium is not exchanged during acidosis, but sodium. If increased hydrogen ion excretion by the kidneys during metabolic acidosis in exchange for calcium leads to hypercalcemia? False. Calcium is not exchanged during acidosis, but sodium. If increased hydrogen ion excretion by the kidneys during metabolic acidosis in exchange for calcium leads to acidosis? False. Calcium is not exchanged during acidosis, but sodium. The mechanism by which gonads produce zygotes. No mechanism, they produce gametes. What is the geographic location of the epididymis? Coiled posterior to the testicle. What is the difference between vas deferens and spermatic cord? The vas deferens is inside the spermatic cord. Where does the testicular artery pass through to feed the testicle? Spermatic cord. What is the meaning of a hymen? Thin membrane. Who can describe the trajectory of the spermatic cord? Where are the tunica albuginea and tunica vaginalis? In the testes. What is the role of the Sertoli cells? They form the blood-sperm barrier, produce testosterone. What is the role of Leydig cells? They inhibit the secretion of FSH and LH. They also promote masculinity, therefore are anabolic. What is the purpose of the acrosome? It contains proteolytic enzymes, lysozyme, that helps penetrate the outer layer of the ovum. The epididymis carry the sperm to the seminal vesicles. False, it is the vas deferens. What is the name of the cilia that move the sperm? No cilia, sperm have a flagellum. What is the ejaculatory duct? Is the result of merging of the vas deferens and the duct of the seminal vesicles. What is the name of the process of making eggs? Oogenesis. What is the name of the process of expelling eggs? Ovulation or ovipositioning. What is the name of the first step of development of a zygote? Morula. What is the name of the territory between the vaginal introitus and the anus? Perineum. What is the labia major, shura? It is where the labia major meet anteriorly and posteriorly. The dilation of the fallopian tube is called infundibulum. False, it is hydrosalpinx. What is the proper name of the vaginal meatus? Introitus. What is the natural most frequent place for fertilization? Distal third of the fallopian tube. What is the name of the indentation proximal to the glans penis? Palancoputial sulcus. What is the name of the pair of muscles that produce the movement of the scrotum? Cremaster and Ardo's muscle. How do gametes multiply? They do not multiply, they are the product of meiosis. How do zygotes multiply? Mitosis. How does blood enter the fetus? Umbilical vein. What is the substance used to determine the eventual presence of molar hydatidiforms?